Firstly, in terms of donor selection, lots happened in donor selection. For example, it is very clear now that younger donors perform so much better. Even the National Marrow Donor Programs now has an age limit in terms of recruitment that's 44. So younger donors perform better, less GVHD, better disease control, less treatment-related complications. There are other immune markers now in terms of donor selection that we can look at and predict how that graft is going to perform in the recipient in terms of GVHD. So in terms of preventing GVHD, donor selection is very important, and that's very new in the last few years, and I think we have the capacity to select donors where the incidence of GVHD will be less. Secondly, in terms of prevention of GVHD, for example, in haploidentical transplant, half-match transplant, where GVHD is, of course, one of the main concerns, the process of giving post-transplant hydrocyclophosphamide to kill activated T cells has been extremely effective. And so we give the graft as a whole. In the first few days after transplantation, there's tremendous expansion of lymphocytes, activated lymphocytes, and 3 and 4 days after the infusion of the cells, we can kill those lymphocytes with hydrocyclophosphamide. So we can do half-match transplants, haploidentical transplant with actually no more GVHD than we would see in a fully matched sibling. So it's been extremely effective. And that way of preventing GVHD is also currently looked at for unrelated donors or sibling donors.